PCAVS is our Pediatric Center for Airway, Voice, and Swallowing. A lot of these children have complex neurologic conditions. Sometimes they will have a respirator and they'll have to carry a ventilator and a suction machine around. Everywhere they go is a production. So it's really key that they can come in here and get multiple appointments at the same time.
They have so many subspecialists and pediatricians involved in their care. We try to make it as convenient as possible for the families, and the providers go into each room.
All of us in our individual specialties get to see a particular child under the same set of circumstances at the same time. And then we can provide a unified plan to go and present that to the family and to the referring pediatrician. And I think it really is a much more collaborative model for care.
A day in PCAVS actually is a very organized day. It starts with our pre-interview. Patients are seen by the providers at separate times.
It's a half-day visit for each child. We kind of flow in and out, and it works. We also provide care to the family by getting to know them and getting to understand what their needs and their desires are for their children.
All of their assistive equipment, their wheelchairs and their ventilators can be in one place at one time while they're seen by 6 to 8 different providers.
They're a lengthy appointment, so I've also been conducting virtual visits prior to coming into the clinic.
How did you start the atropine drops that EMT talked about?
So that we get a lot of that information, the parental concerns. I think the Cleveland Clinic's had a lot of foresight to be able to say, hey, this is really difficult for people. We need to find a way to navigate this complex system.
One of the reasons that we developed the PCAVS clinic is because children who have aerodigestive issues will often need multiple surgeries with multiple providers.
General anesthesia that's multiple times and prolonged isn't great for neurologic development. Anything you can do to limit those things and help make this child live as normal a life as possible, I think is really the goal here at the Cleveland Clinic.
So we're decreasing the amount of anesthesia exposure that kids have by taking all the providers at the same time.
It's a dance in the OR. I mean, we have often at least 3 disciplines. We can do these diagnostic procedures under a single anesthesia, and it provides us with an ability to make decisions as we stand next to each other in the operating room and say, what do you think about this? Why don't we go ahead and try this? And it's very, very helpful.
When you have a medically fragile child, other parents cannot comprehend how often you're making trips to see specialists.
If you could imagine, at one point he had probably 6 to 8 doctor's appointments every month.
My name is Melinda. I'm going to take care of you today.
The Cleveland Clinic said to us, well, we're trying something new. It's called the PCAVS Clinic, where you come to us and all the doctors come to you at one time. So they all get the same snapshot of Caden and the way he is right then and there. So that's really neat.
The family members know that the practitioners and staff are very invested in their child.
I think we put ourselves in their shoes and realize how difficult it is for them and want to give them the care that we would want our own kids to receive.
Our priority is a patient-centered care here. We're going to put you and your family at the center of that care and make it easier for you, make your quality of life better.